to the channel. We have come up with another video, that is part 2 for skin and vesiculobullous lesions. As I have told you that this video contains 10 MCQs in 10 minutes. So let's get started. As we have started 10 MCQs in the previous part, that is part 1 for skin and vesiculobullous lesions, today we will be starting further. Okay, so we'll be doing question number 10, that is Greenspan syndrome. Greenspan syndrome is associated with what? Greenspan syndrome is associated with what? And the options are hypertension, diabetes, lichen planus, oral ocular genital, hypertension with oral lesions, pemphigus, CHF, and diabetes. So there is a trick to learn this question, that Greenspan syndrome. Whenever something Greenspan comes, span means life. Okay, span means life, and with age we know that hypertension, diabetes, and lichen planus do occur. Yes, lichen planus also has a tendency to occur with age. That's why option A is the answer. So you should know that Greenspan, span means life, life means hypertension, diabetes, lichen planus. Question number 11. A fluid-filled elevated lesion of the skin is known as. Okay, so as I have told you, you can see here, you can turn your screens and you can see the question number 11. Along with this, you can see that I have written this a table of with 6 lesions here: macule, papule, plaque, vesicle, bullae, pustules. So they have asked us about this question, that fluid filled. So fluid filled are the vesicle, bullae, and pustules. And as you can see the options, there is only one which is bullae given in the option, so that's why answer is bullae. So you have to learn this table, that is macule, papule, plaque, vesicle, bullae, pustules. Their features are written here. Macule is flat, papule is less than 1 but raised, plaque is greater than 1 centimeter, vesicle is elevated blister with clear fluid, bulla is large vesicle with greater than 1 centimeter, and pustules is elevated with purulent material, not a clear one. Next question is question number 12. Which of the following is not a type of lichen planus? So as we have read earlier, that verrucous is not a form of lichen planus. Yes, and that is so. I can also show you here. Okay, so I think that will be covered in further questions, but I would like to say that this form, okay, verrucous form is not in the case of lichen planus, it is in the case of leukoplakia. So you have to know this. Along with this, there are the forms, and we have a mnemonic also, so you can also write it. We have reticular form, we have bullous form, we have atrophic form, we have hypertrophic form, and we have erosive form. Okay, so that's why the answer is verrucous. Now let's come to the question number 13. Unusual extensibility of the tongue is a characteristic feature of. Unusual extensibility. So if we look at the answers, actually the answer is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Now what is Ehlers-Danlos syndrome? There are 3 H in Ehlers-Danlos syndrome that you have to learn. There is hyperelasticity, there is hyperextensibility, and there is hypermobility. So hyperelasticity related to skin, hyperextensibility related to joints, and TMJ, it is related to hypermobility, which leads to dislocation. So as the question has asked, what is about tongue? So that's why tongue become elastic. Okay, that's why it's a Ehlers-Danlos syndrome. And an additional feature is that there's multiple pulse stone formations. So you have to learn this. Next question is question number 14. That is Zinc smear test is used in the diagnosis of. Now Zinc smear test is used in the diagnosis of what? Let's see to the answers. Okay, so you have to learn this, that Zinc smear test is a diagnosis which is used for viral infections. If somebody is having viral infection and you need to diagnose it, you have to do Zinc smear test. Viral infection, for example, herb zoster infection. Herb zoster is a viral infection, and herb zoster is responsible for pemphigus infections. Pemphigus. That's why the option A is correct, that is pemphigus, because pemphigus is related to the viral infections. Now talking about question number 15, Koebner phenomenon. commoner phenomenon is seen in what? The answer for the commoner phenomenon is C, that is psoriasis. Commoner phenomenon seen in psoriasis, and I have a mnemonic that you should learn because it will help you better. You can see a commoner phenomenon, it's like कूब, किसी का कूब निकलना, ठीक है? तो psoriasis का क्या मतलब होता है? स्किन रैश होना. तो स्किन पे रैश हुए तो ऐसे से रैश जो उठे हुए हैं, कूब निकला हुआ है. You can learn this. It's a silly trick, but I think you will be able to remember. Next question is question number 16. That is your diarrhea disease is associated with. Diarrhea disease is associated with what? And the answer is C option. That is vitamin E deficiency and involvement of oral epithelium and skin. This is the answer. You have to learn this. It is not related to anemia. It is not related to rickets. That's why option A and B are incorrect. Jump to question number 17, erythema multiforme. Now what is erythema multiforme? Erythema multiforme is acute self-limiting disease of skin and oral mucous membrane. You have to learn this. Option A is correct. That is acute self-limiting disease of skin and oral mucous membrane. Okay, so you have to learn this. Okay. Now let's jump to question number 18. Question number 18 is scleroderma involvement. Now scleroderma involves what? You have to learn this, that scleroderma involves all the three options. The correct answer is D, that is all of above. So there is tightening of oral mucosa, there is periodontal involvement, there is multiple palmar keratosis, and there is Raynaud's phenomenon. Scleroderma is related to three things: tightening of oral mucosa, multiple palmar sclerosis, and Raynaud's phenomenon. You can also see here, I have written it below, that is tightening of oral mucosa, periodontal involvement, palmar keratosis, and Raynaud's phenomenon. Jump to question number 19, that is in acrodermal dysplasia, all of the following structures are affected except hair, teeth, nails, salivary glands. Now this is a tricky question, that is question number 19. According to the fourth edition of Schaeffer's, the answer is D, that is there is no involvement of salivary gland, but as you're gonna see in your textbooks right now, there is also involvement of salivary glands in the new editions. So it's a tricky question. You should learn this, that in earlier, that's why the answer is D, but actually all the four are involved. There is no exception here, but in the old edition it was written that salivary glands are not involved. That's why you're gonna learn this. Now let's jump to question number 20. Now what this question number 20 says. Pemphigus is characterized by. Now what is pemphigus and what is the characteristic feature? Now if we see to this, you can see here what is pemphigus. Pemphigus is basically a bullae or vesicle formation which is intraepithelial. Intraepithelially there is bullae and vesicle formation which is just above the basal layer. Now due to this, there are bridges, intercellular bridges which were present, so they disappear because of the edema. Edema occurs, and due to this the bridges disappear, and due to this acantholysis occurs. Now after this, clumps of degenerative cells are found, and these clumps called as Zinc cells. So you have to learn that there is acantholysis. Acantholysis occurs in the case of pemphigus. So that's why option B is correct, that is acantholysis. So I think you must be having a doubt in question number 19. So I must read the answer which is written. Okay. So according to this pulse, option D is correct according to Schaeffer's fourth edition. Actually, all the four options are involved in acrodermal hypoplasia. Hypoplasia of salivary glands with resultant xerostomia is also seen in ectodermal dysplasia. We were talking about acrodermal dysplasia. हम क्वेश्चन में acrodermal dysplasia की बात कर रहे हैं. तो इन्होंने क्या कहा है कि salivary gland का hypoplasia हो जाता है जिससे कि xerostomia हो जाता है, और ये ectodermal dysplasia में देखा गया है. लेकिन जो फोर्थ एडिशन है शेफर्स का, अकॉर्डिंग टू दिस salivary gland involved नहीं होती, तो इसलिए हमने आंसर 4 कलेक्ट करा है। तो आई होप आपको ये वीडियो यूजफुल लगा होगा, एंड इफ यू लाइक दिस, डू लाइक, शेयर एंड सब्सक्राइब my video and my channel. Thank you.